Anytime a doctor performs a procedure on a patient, he must weigh the risks against the benefits.
If the risk significantly outweighs the benefit, then certainly it's not something that you would do.
Local surgeon Ricardo Eusebio tells Newswatch that unless a disaster's at hand, generally there's no reason to take unnecessary risk. Following an anonymous tip, Guam Newswatch decided to check out whether local radiology clinic MDX Imaging Center was taking unnecessary risks with its patients.
There's a doctor there all day long, yeah?
Our doctors are on call.
I'm sorry, they're there?
They're on call.
Yeah.
I'm sorry, there's not a doctor there?
Not in the facility. We have our techs on site, but the doctors are on call.
The real problem may be that they might not even be there when a patient responds badly to a procedure like an injection. According to the American Journal of Radiology, the Centers for Medicare and Medicaid Services designate levels of supervision for all imaging procedures. The journal specifically points out that under CMS standards, a doctor must directly supervise diagnostic CAT scans requiring dye or contrast injections.
By injecting dye, it gives you a clearer picture of what you're looking for. Those are the positive things. The negative things about injecting dye is that when you inject dye, there are possible reactions to the dye, so much so that immediate therapy may be necessary, and that's why it's important to have a physician available.
Newswatch went undercover to find out whether doctors are on duty when they need to be at MDX.
Sometimes if they do the injections, and if it's safe, if we need to send some young guy, we can send him over. They don't need to call the doctor, right?
Yes.
Yeah, okay, just want to be sure. So because I don't want to, make it that we always have to have a doctor there. That would be silly. So unless they ask for a doctor, you might not get a doctor.
Right.
Is that right?
Yes.
Okay, even doesn't matter whether it's ultrasound, CAT scan with injection, doesn't matter. You have to ask for a doctor to be there.
Yes.
Dr. Eusebio says he would not knowingly send a patient to an imaging center with no doctor on duty.
I don't know what they do over there, but when we inject dye over at GMH, we have a doctor present.
Eusebio is medical director of Guam Memorial Hospital and says even the lowest risk procedures require doctors. That doctors who allow their non-physician staff to perform such procedures alone could lose their medical licenses.